Hello everyone. Can you imagine having to have a tube inserted into your nose and down into your stomach? I know, it sounds crazy, right? Well, occasionally, while admitted to the hospital, some patients will have to have this procedure performed. This is called having a nasogastric, or NG tube, inserted. It's not as scary as it sounds. It is minimally invasive and it only takes a couple of minutes to perform. I want this speech to give you a better understanding of the procedure that is being performed just in case you or someone you know ever has to have it done. I in no way expect you to become an expert or even be able to perform the procedure. I just want you to be better educated on the subject. It helps to ease your patient's nerves if you explain exactly what you're going to do and the things that they can expect to experience during the procedure. Let your patient know that the doctor has requested that they have an NG tube placed to drain the contents of the stomach. Usually, this is after a surgery or during a major illness so that the stomach can rest. Let them know that the procedure itself is rather uncomfortable, but that it's necessary. And there are certain things that you need to tell your patient. They need to sit up straight and extend their neck almost like a bird to straighten out the esophagus, which is the tube that goes from the mouth into the stomach. You will have water with a straw, and when instructed, they'll need to continually take sips of water, which allows the tube to go down the esophagus easier. Let them know that they may or may not have the feeling of needing to gag, cough, or tearing of the eyes. That is normal, and there'll be a basin just in case they feel the need to vomit. Tell them that once the tube is in, it will be hooked up to a canister that has suction applied in order to get all of the contents from the stomach removed. Make sure that they know that this will not hurt at all once the tube has been placed. Once the tube is inserted, there might be some slight discomfort in the back of the throat from the tube, but otherwise it's painless. It always makes the patient feel a little bit more at ease if you come in completely prepared for your procedure. Knowing your procedure is one step, but having all of your required equipment is another important factor. You don't want to be in the middle of your procedure and you're missing something vital to the completion. Not only can it cause the patient to lose faith in you as a healthcare provider, but it can also cause you to become flustered, therefore possibly causing the procedure to not go as smoothly as you would like. Once you have explained your procedure and prepared your patient, it's time to gather your supplies and insert the NG tube. There isn't a whole lot that's required to insert an NG tube. As uncomfortable as it may be for a minute or two, the procedure itself is actually pretty simple. The supplies that you'll need for your procedure are your NG tube, which is this, a water-soluble lubricant to put on the tip of the tube so that you can insert it into the nose easier. This is called a TUMI syringe, which is just a big 60 cc syringe. An emesis basin just in case your patient feels the need to vomit. A cup of water and a straw, and a stethoscope to check for placement at the end. Inserting the NG tube is actually pretty easy, so before you start, have your patient sit up straight and advise them to stick their neck out almost like a crane. Have someone available to hold the cup of water for your patient. You may have to measure the NG tube from the tip of the nose to the jaw and down to what is called the xiphoid process, which is the center of your chest. That lets you know how far the tube needs to be inserted. Once you have measured and marked the tube, you will apply a lubricant to the tip of the NG tube and insert it into typically the right nostril. It tends to be a little bit easier that way. Instruct the patient that once they feel the tube in the back of the throat, to start drinking the water. Once the tube has been inserted to where it has been marked, the tube needs to be secured to the nose so that it doesn't get pulled out, which is actually a pretty easy accident, and it happens quite a bit. Once the tube has been inserted, and you have to check for placement to make sure that it's in the right place. There are only two ways to check for tube placement. The easiest and initial way to check for correct placement of the NG tube is with the TUMI syringe and a stethoscope. You would just fill the syringe with air and you're going to hook it up to the end of the tube just like this. And you'll place the stethoscope over the stomach and push the air into the tube quickly. When you do so, you should hear a swooshing sound in the stomach. If you do, the tube is in the correct place. If not, then you may need to advance the tube a little bit farther into the stomach. The more definite and time-consuming way to check for placement of a tube is to take an x-ray of the abdomen. The x-ray method is a lot more accurate because it can tell you exactly where the tube is. Most NG tubes nowadays have what they call a radiopaque stripe, which allows you to see the tube perfectly in an x-ray. If the tube is going to be placed for an extended period of time, an x-ray is definitely something that is recommended. So that's pretty much the process for placing an NG tube. Like I said, it's pretty easy. So, although the placement of an NG tube may be uncomfortable, it is pretty simple. Ensuring that your patient is completely aware of what is going to happen during the procedure helps because it eases nerves a little bit and allows for a smooth process. As the person inserting the NG tube, your patient is trusting you, so ensuring that you know what you're doing as well as having all your supplies to complete the procedure is vital. Once the tube is inserted, you must also make certain that it is in the correct place. So I doubt anyone is ready to go out and start performing this procedure. Well, at least I hope so. But hopefully this at least shined a little bit of light onto the process. Thank you.